Welcome back to Daytime, everyone. No matter how old you are or where you live, medical issues crop up all the time. The main thing on people's minds these days seems to be the swine flu. As school is underway, we thought we'd help dispel some of the myths surrounding this illness. Today, we are joined by Dr. Karon LoCicero. And Dr. LoCicero, I want to start by asking about symptoms of swine flu. Does it feel different from having the regular flu?
No, actually, no. The swine flu is the flu. It's a different type of flu. It's the H1N1 virus, but it's the flu. And the symptoms are the same: a sore throat, a cough, congestion, fever, chills, the achy feeling.
And should you run to your doctor right away when you feel these coming on, or do you call your doctor, or do you just stay put?
Basically, young, healthy people can stay put. It's probably good to stay home, get out of school, get out of work for about a week is what it takes. If you are not a healthy person, pregnant women, people with chronic illnesses, or anybody who's having persistent fevers, signs of dehydration, they should call their physician immediately.
Do the masks really work?
Oh, the masks they're okay. They're not. There's no proven data that show that they're very effective. There's really no data out there that show how effective they are. So if somebody wants to wear a mask, that's fine. But it's really more important to have good hygiene, wash your hands frequently, use soap and water, use the hand sanitizers, which seem to be everywhere these days.
Yes, they are, thank you.
And also trying not to touch your face, because you can introduce the virus through your mouth, your nose, your eyes, from your hands. And if you cough, to use tissues. Don't cough into your hands where you can get the virus and spread it.
Or the elbow, if that's all you've got.
Right.
And finally, about this subject, the vaccine for the flu that people have been getting lately is not the same vaccine for the swine flu, right?
No, different vaccine.
Okay.
Different vaccine.
So even though you might have had that shot,
you still need the H1N1 vaccine.
Okay.
Even if you had the regular flu shot.
And I understand from what I'm reading lately that not necessarily going to get it free at your office this year, because they're going to use that vaccine for people who are priority.
Right. The priority people would be the pregnant women who are at high risk for developing complications from the flu, and people who actually the younger people who haven't been exposed to many flu viruses in the past, so they're more susceptible.
And that's supposed to be available, what, first week of October?
First or second weekend of October, right.
Okay, good to know. Now, pancreatic cancer, we all remember, very sad, the passing of Patrick Swayze. He had a what, 2-year battle. Let's talk about how common this cancer is. Fourth most common.
It's the fourth most common cancer in the United States. And it's a very difficult cancer to find early, unfortunately. And it's very difficult to cure. There is a very slim chance of curing this type of cancer.
Is that because it's not detected early? Because there are no real, are there symptoms?
The symptoms when they do present are usually when a patient's already in the later stages of cancer, unfortunately. And a patient may present with yellow jaundice. Their eyes are yellow, their skin is yellow. They may present with weight loss, poor appetite, a lot of vague symptoms. Unless they develop a more progressive disease, then they start to develop pain from the abdominal swelling, the obstruction of the bile ducts that can cause pain.
And I understand the thing about this cancer is the problem is it often spreads to the different organs, and that's when you really come into problems. Is there anything we can do to prevent getting this kind of cancer?
The best prevention is not smoking. Smoking is a big risk factor for pancreatic cancer.
I don't think a lot of people know that.
No,
you don't hear of that. All you think of is lung cancer, but no.
Smoking and obesity is also a risk factor as well. So keeping weight under control is very important.
All right, and there are treatments out there for it, though, but you have to get it early.
It has to be found early, and that's the difficult part, is finding it early.
Okay, Dr. Karon LoCicero, thank you so much for coming in today. Hey, just ahead on Daytime, relief for people who can't make a dent in their mounting debt load. We'll be right back.
Daytime like you've never seen it. So hot you'll be seeing stars.
That is what makes daytime great.
Big guests, big interviews, and a whole lot more. If you owe over